when someone gets diagnosed with osteoporosis, osteopenia, they're faced with a couple questions. What do they do? What are the choices? What are the possible treatment options for them? Medication is certainly one. There's lots of medications that are advertised on TV that claim to improve bone mineral density. But we look at it completely different here. Using the Be Strong for Life system, in order to have an improvement on the bone mineral density. So I have a couple little samples of bone tissue. The one in this hand over here on the right is an osteoporosis cross-section of a bone, and this is a normal bone. If you were to look at this under a microscope, you can see it's more, the osteoporosis bone is more porous. But before we get to that point, when we think about bone, we're thinking about, this is with the spine, we're thinking about the quality of the bone, and then we're thinking the position of the bone. Well, we start everything with a structural assessment. That structural assessment is going to measure, everyone is different. It's going to measure your spine position from the front. It's going to measure your spine position from the side. We're going to take your posture from the front, we take your posture from the side, and we're going to assess clinically, is there anything in your spine that we need to be aware of? Is there anything that we need to maybe modify the program because you have a hip, artificial hip or whatever may be going on? But we're going to do a structural assessment. That allows us to customize the program for you. Because when we get a change of a DEXA scan like this, which is a percentage improvement in bone mineral density, by using the Be Strong for Life system, we know several factors have occurred. We know one, when we produce a force production or strength improvement chart, we know that the chart has dramatically improved this patient here, 61% improvement in strength. We know that their posture's improved. We know that their spinal alignment has improved. We know many things have improved, and yet what really is exciting is that their activities of daily living, those are the things that are quietly improving. Like walking up the stairs, like taking groceries out of the car, like taking care of the grandkids, or whatever it may be, golfing, whatever it may be. But those are all the benefits of doing this type of alternative for bone mineral density of osteoporosis, osteopenia, is that all those other factors change. And yet if you do something like a medication, there's really not a lot of change other than the DEXA scan. So when we think about Be Strong for Life, it really is the best alternative, natural alternative to building bone tissue in a clinical setting.